Red meat allergy. Up to 450,000 Americans may have been affected by a potentially life-threatening red meat allergy caused by ticks. Many doctors remain unaware of what it is or how to treat it, according to the Centers for Disease Control and Prevention. The syndrome, also known as a red meat allergy or tick bite meat allergy, stems from alpha-gal, a sugar molecule not naturally present in humans. Growing evidence suggests that AGS is primarily associated with saliva from the lonestartick. The CDC has described it as a very aggressive tick that bites humans. It is widely distributed across southeastern and south-central states. According to the CDC, localities in the southern, midwestern and mid-Atlantic regions of the U.S. have identified more people who tested positive with AGS. CDC epidemiologists said AGS is an important emerging public health problem, with potentially severe health impacts that can last a lifetime for some patients. What is alpha-gal syndrome? Alpha-gal syndrome, also known as alpha-gal allergy, is a medical condition that causes allergic reactions to a carbohydrate molecule called alpha-gal. This molecule is found in the meat of mammals, including beef, pork, lamb, and other red meats. People with alpha-gal syndrome produce antibodies against alpha-gal. When they consume these meats, their immune system triggers an allergic reaction. The most common symptom of alpha-gal syndrome is delayed allergic reactions occurring several hours after consuming red meat. These reactions can range from mild to severe and may include hives or skin rash, itching, swelling, gastrointestinal symptoms, nausea, vomiting, diarrhea, respiratory problems, coughing, wheezing, shortness of breath, anaphylaxis, a severe, life-threatening allergic reaction. Alpha-gal syndrome is unique because the allergic response is delayed and typically occurs 3 to 6 hours after consuming red meat. This makes it different from typical food allergies that usually manifest within minutes of exposure. The primary cause of alpha-gal syndrome is believed to be tick bites. The allergy-causing alpha-gal molecule is thought to be transmitted to humans through the saliva of certain ticks. Most commonly the lone star tick, Amblyomma americanum, found in the southeastern United States. However, cases have been reported in other regions as well, including Europe, Australia, and Asia, where different tick species may be involved. If someone suspects they have alpha-gal syndrome or experiences allergic reactions after consuming red meat, they should seek medical attention for proper diagnosis and management. The treatment usually involves avoiding red meat and products containing alpha-gal, as well as carrying an epinephrine auto-injector, EpiPen, in case of severe allergic reactions. An allergist or immunologist can provide guidance on managing the condition and avoiding potential triggers. What foods and products contain alpha-gal? Alpha-gal is a carbohydrate molecule found in the meat of mammals, particularly in beef, pork, lamb, and other red meats. However, alpha-gal can also be present in some non-meat products due to the use of animal-derived ingredients or additives. Here are some foods and products that may contain alpha-gal. 1. Red meat, beef, pork, lamb, venison, bison, and other meats from mammals are the primary sources of alpha-gal. 2. Processed meats, sausages, hot dogs, bacon, ham, and other processed meats made from mammalian sources may contain alpha-gal. 3. Gelatin. Gelatin is derived from animal collagen and is commonly found in gummy candies, marshmallows, desserts, and some medications. It can come from mammalian sources and may contain alpha-gal. 4. Dairy products. While alpha-gal is not typically found in milk, butter, or cheese, some individuals with severe allergies may experience cross-reactivity due to contamination from meats during processing. 5. Medications and vaccines. Some medications and vaccines may contain gelatin as a stabilizer or excipient, potentially sourced from mammalian tissues and containing alpha-gal. People with alpha-gal syndrome should consult their healthcare provider to identify safe alternatives. 6. Cosmetics and personal care products. Certain cosmetics, soaps, lotions, and other personal care products may contain animal-derived ingredients, and there is a possibility of alpha-gal contamination in such cases. 7. Food additives and flavorings. Some food additives and flavorings might be derived from animal sources, potentially containing alpha-gal. It's important to note that the presence of alpha-gal in non-meat products is less common than in red meat. And reactions to these products may vary depending on the individual's sensitivity. For individuals with alpha-gal syndrome or a history of allergic reactions to red meat, it's crucial to read product labels carefully and consult with healthcare professionals if uncertain about specific products or ingredients. Avoiding red meat and being cautious about potential sources of alpha-gal is the best approach for managing this allergy. Who gets alpha-gal syndrome? Alpha-gal syndrome is primarily associated with tick bites, specifically bites from the lonestartick, Amblyomma americanum, found predominantly in the southeastern United States. However, cases of alpha-gal syndrome have also been reported in other regions, where different tick species may be involved, such as Europe, Australia, and Asia. The condition can affect individuals of all ages and backgrounds, but it appears to be more common in adults. It is believed that repeated tick bites over time may increase the likelihood of developing alpha-gal syndrome. Additionally, spending time in outdoor activities, particularly in wooded or grassy areas where ticks are prevalent, may also be a risk factor. Genetics. Some studies have suggested that certain factors, such as genetics and previous allergic sensitivities, might play a role in determining who is more susceptible to developing alpha-gal syndrome after tick exposure. However, more research is needed to fully understand the specific risk factors and mechanisms involved. It's essential to note that not everyone who is bitten by ticks will develop alpha-gal syndrome. The condition seems to be relatively rare compared to other food allergies. If someone experiences symptoms of alpha-gal syndrome, such as allergic reactions after consuming red meat or meat-derived products, they should seek medical attention for proper diagnosis and management. An allergist or immunologist can conduct tests to confirm the presence of alpha-gal antibodies and provide guidance on managing the condition and avoiding potential triggers. What types of ticks can cause AGS? Alpha-gal syndrome, AGS, is primarily associated with tick bites, and the lonestartick, Amblyomma americanum, is the species most commonly linked to the development of this condition. However, cases of AGS have been reported in other regions where different tick species may be involved. Some of the other tick species that have been associated with AGS include 1. Ixodes scapularis, blackleg tick or deer tick. This tick is well known for transmitting Lyme disease and is found in the northeastern, north-central, and Pacific coastal regions of the United States. 2. Ixodes ricinus, found in Europe. Ixodes ricinus has been implicated in AGS cases in European countries. 3. Ixodes holocyclus, Australian paralysis tick. This tick species is found in eastern Australia and has been linked to AGS cases in the region. 4. Other Ixodes species, apart from Ixodes scapularis and Ixodes ricinus. Other tick species belonging to the Ixodes genus have also been associated with AGS in various regions. It's important to note that not everyone who is bitten by ticks carrying the alpha-gal molecule will develop AGS. The development of AGS seems to depend on individual factors, such as genetics and previous allergic sensitivities. Additionally, not all tick bites result in the transmission of alpha-gal, and the risk of developing AGS after a tick bite appears to be relatively low. If someone experiences symptoms of AGS, such as allergic reactions after consuming red meat or meat-derived products, they should seek medical attention for proper diagnosis and management. An allergist or immunologist can conduct tests to confirm the presence of alpha-gal antibodies and provide guidance on managing the condition and avoiding potential triggers. Are there other conditions like alpha-gal syndrome? Yes, there are other conditions similar to alpha-gal syndrome, AGS, in terms of being triggered by specific allergens or substances. These conditions involve delayed allergic reactions or unique triggers, similar to AGS. Some of these conditions include 1. Delayed food allergies. AGS is unique in causing delayed allergic reactions to red meat due to the alpha-gal carbohydrate. Similarly, Some individuals may experience delayed allergic reactions to other foods, such as fish, shellfish, or fruits. These reactions may not occur immediately after consumption but can manifest several hours later. 2. Oral allergy syndrome, OAS, also known as pollen food syndrome. OAS occurs in individuals with pollen allergies who experience cross-reactions to certain fruits, vegetables, and nuts. The proteins in these foods are structurally similar to pollen, leading to allergic reactions when consumed. Symptoms often involve itching, tingling, or swelling of the lips, mouth, throat, and palate. 3. Exercise-induced anaphylaxis. In some individuals, physical activity can trigger an allergic reaction, leading to anaphylaxis. Certain foods, medications, or environmental factors may increase the risk of exercise-induced anaphylaxis. The exact triggers can vary from person to person. 4. Mast cell activation syndrome, MCAS. MCAS is a condition where mast cells, which are part of the immune system, release excessive amounts of chemicals, leading to a range of symptoms such as hives, flushing, abdominal pain, and anaphylaxis. MCAS can be triggered by various factors, including certain foods, medications, temperature changes, stress, or physical exertion. 5. Red meat allergy. Apart from AGS, some individuals may have an immediate allergic reaction to red meat due to other allergens like beef or pork proteins. This is different from AGS, where the allergy is specifically directed towards the alpha-gal carbohydrate. It's important to note that while these conditions share some similarities with AGS in terms of delayed reactions or unique triggers, they are distinct in their underlying mechanisms and allergens. If someone experiences symptoms of a food allergy or any other allergic reaction, it's essential to seek medical attention for proper diagnosis and management. An allergist or immunologist can help identify specific triggers and develop an appropriate treatment plan. Are there other names for alpha-gal syndrome? Yes, alpha-gal syndrome is also known by other names, and these names are often used interchangeably to refer to the same condition. 1. Alpha-gal allergy. This name highlights the allergic nature of the condition, where the immune system reacts to the alpha-gal carbohydrate found in certain mammalian meats. 2. Alpha-galactose allergy. Alpha-gal syndrome is sometimes referred to as an alpha-galactose allergy because alpha-gal is a type of alpha-galactose molecule. 3. Mammalian meat allergy. This name emphasizes that the allergy is specific to the consumption of meat from mammals, such as beef, pork, and lamb. 4. Red meat allergy. Since the primary trigger for alpha-gal syndrome is the consumption of red meat, this name is commonly used to describe the condition. 5. Lonestartick allergy. This name highlights the association between alpha-gal syndrome and tick bites, particularly from the lone star tick, which is a common vector for the allergy. It's essential to be aware of these alternative names, as they may appear in different sources of information or medical literature. How common is alpha-gal syndrome? Alpha-gal syndrome, AGS, was considered relatively rare compared to more common food allergies like peanut or shellfish allergies. The prevalence of AGS varies depending on the geographic region and the presence of specific tick species known to transmit the alpha-gal molecule. The majority of reported AGS cases have been linked to tick bites from the lone star tick, which is prevalent in certain regions of the southeastern United States. In these areas, the prevalence of AGS has been higher compared to other parts of the country. AGS cases have also been reported in other parts of the United States and in various countries worldwide, where different tick species might be involved. What causes alpha-gal syndrome? Alpha-gal syndrome, AGS, is caused by an allergic reaction to a carbohydrate molecule called alpha-gal, alpha-galactose. This molecule is found in the meat of mammals, such as beef, pork, lamb, and other red meats. The immune system of individuals with AGS recognizes alpha-gal as foreign and produces antibodies against it. The primary trigger for AGS is the bite of certain ticks, particularly the lone star tick in the southeastern United States. It is believed that the tick transmits alpha-gal to the human body through its saliva during the feeding process. Over time, repeated tick bites can sensitize individuals to alpha-gal, leading to the development of an allergic response. After consuming red meat or meat-derived products containing alpha-gal, individuals with AGS may experience delayed allergic reactions. This is because the immune system takes some time to mount a response, and the allergic symptoms typically occur 3 to 6 hours after eating the meat. It's important to note that not everyone who is bitten by ticks carrying alpha-gal will develop AGS. The condition seems to depend on individual factors, such as genetics and previous allergic sensitivities. Additionally, AGS is more commonly reported in adults than in children. As our understanding of AGS and its underlying mechanisms continues to evolve, more research is needed to fully elucidate the causes and risk factors associated with this condition. If someone experiences symptoms of AGS or has concerns about the condition, they should seek medical attention for proper diagnosis and management. An allergist or immunologist can conduct tests to confirm the presence of alpha-gal antibodies and provide guidance on managing the condition and avoiding potential triggers. What are symptoms of alpha-gal syndrome? Alpha-gal syndrome, AGS, is characterized by delayed allergic reactions that occur several hours after consuming red meat or meat-derived products containing alpha-gal. The symptoms of AGS can vary in severity from mild to severe and may include 1. Hives or skin rash, red, itchy, raised welts on the skin, similar to other allergic reactions. 2. Itching. Generalized itching of the skin, often accompanied by the appearance of hives. 3. Swelling of the face, lips, tongue, or throat, which can be concerning and potentially dangerous if it affects the airway. 4. Gastrointestinal symptoms, nausea, vomiting, abdominal pain, or diarrhea may occur as part of the allergic reaction. 5. Respiratory problems, coughing, wheezing, shortness of breath, chest tightness, and other respiratory symptoms are possible. 6. Anaphylaxis. In severe cases, AGS can lead to anaphylaxis, which is a life-threatening allergic reaction. Anaphylaxis symptoms may include difficulty breathing, a drop in blood pressure, rapid heart rate, confusion, loss of consciousness, and a feeling of impending doom. Anaphylaxis requires immediate medical attention and the use of an epinephrine auto-injector, EpiPen, if available. It's important to note that the allergic reactions in AGS are distinct in their delayed onset, typically occurring 3 to 6 hours after consuming red meat, as opposed to immediate reactions seen in most food allergies. This delayed response can sometimes make it challenging for individuals to associate their symptoms with the consumption of red meat. If someone suspects they have AGS or experiences allergic reactions after consuming red meat or meat-derived products, they should seek immediate medical attention, especially if there are signs of anaphylaxis. An allergist or immunologist can conduct tests to confirm the presence of alpha-gal antibodies and provide guidance on managing the condition and avoiding potential triggers. What can affect symptoms of alpha-gal syndrome? Several factors can affect the symptoms and severity of alpha-gal syndrome, AGS, in individuals who are sensitized to alpha-gal. These factors can influence the intensity and timing of allergic reactions after consuming red meat or meat-derived products. Some of the key factors that can affect AGS symptoms include 1. Amount of alpha-gal ingested. The amount of alpha-gal consumed in a meal can influence the intensity of the allergic reaction. Larger quantities of alpha-gal may lead to more severe symptoms. 2. Type of meat consumed. Different types of red meat contain varying levels of alpha-gal. Some meats might trigger stronger reactions than others, depending on the individual's sensitivity. 3. Individual sensitivity. Each person's immune system reacts differently to alpha-gal. Some individuals might be highly sensitive, while others might have milder reactions. 4. Previous exposure. The frequency of exposure to alpha-gal, such as repeated tick bites over time, can influence the body's sensitivity and the likelihood of developing AGS. 5. Cofactors. Certain factors, such as physical exercise or alcohol consumption after eating red meat, have been reported to exacerbate AGS symptoms in some individuals. 6. Cross-reactivity. Some individuals with AGS may experience cross-reactivity to other substances or allergens, leading to additional or more varied allergic reactions. 7. Concurrent allergies. Individuals with AGS may have other allergies, such as pollen or insect allergies, which can influence the overall allergic response. 8. Immune system status. The overall health of a person's immune system can impact the response to alpha-gal and allergic reactions. It's important for individuals with AGS to pay attention to their symptoms and any factors that seem to influence their allergic reactions. Keeping a food diary and noting any potential triggers or patterns can be helpful for identifying specific influences on AGS symptoms. What if I take the cancer drug Cetuximab, Erbitux? If you are taking the cancer drug Cetuximab, brand name Erbitux, and you have alpha-gal syndrome, AGS, it is crucial to be aware that Cetuximab contains a small amount of alpha-gal. This means that individuals with AGS may be at risk of experiencing allergic reactions when receiving Cetuximab treatment. Cetuximab is a monoclonal antibody used to treat certain types of cancer, including colorectal cancer and head and neck cancer. It works by targeting and inhibiting the activity of a protein called epidermal growth factor receptor, EGFR, which is overexpressed in some cancer cells. The presence of alpha-gal in Cetuximab can potentially trigger an allergic reaction in people with AGS. If you have AGS and your healthcare provider is considering Cetuximab as part of your cancer treatment, it's essential to inform them about your alpha-gal allergy. The medical team can take precautions to manage the risk of allergic reactions, such as 1. Pre-treatment evaluation. Your healthcare provider may conduct tests to check for alpha-gal antibodies or perform skin testing to assess your sensitivity to Cetuximab. 2. Medication pre-treatment. You may be given antihistamines or corticosteroids before Cetuximab infusion to help reduce the risk of allergic reactions. 3. Slow infusion rate. Your healthcare team may administer Cetuximab at a slower rate initially to monitor for any signs of allergic reactions. 4. Close monitoring. During and after Cetuximab administration, healthcare providers will closely monitor you for any signs of allergic reactions or adverse effects. 5. Epinephrine availability. It's essential to have access to an epinephrine auto-injector, EpiPen, in case of a severe allergic reaction, anaphylaxis. It's important to note that the information provided here is for general knowledge purposes and does not replace individualized medical advice. Why is alpha-gal syndrome difficult to diagnose? Alpha-gal syndrome, AGS, can be challenging to diagnose for several reasons. 1. It can be challenging to diagnose alpha-gal syndrome. Tick bites are painless, so many people who develop tick-borne illnesses often don't realize they've been bitten. 2. Delayed onset of symptoms. AGS is characterized by delayed allergic reactions that occur several hours after consuming red meat or meat-derived products containing alpha-gal. This delayed onset can make it difficult for individuals to associate their symptoms with the specific food they consumed, leading to delays in seeking medical attention and diagnosis. 3. Uncommon food allergy. AGS is relatively rare compared to other food allergies, and healthcare professionals may not immediately consider it as a potential diagnosis, especially if they are not familiar with the condition. 4. Lack of awareness. Many healthcare providers might not be aware of AGS or its characteristic delayed allergic reactions, leading to misdiagnosis or delayed diagnosis. 5. Similar symptoms to other conditions. The symptoms of AGS, such as hives, itching, and gastrointestinal issues, are similar to those of other allergies and conditions. This overlap in symptoms can complicate the diagnostic process. 6. Lack of routine testing. There is no standardized test for AGS, and it may not be included in routine allergy testing panels. As a result, it may not be detected in standard allergy tests. 7. Non-IgA mediated allergy. AGS is classified as a non-IgA mediated allergy, which means that traditional allergy tests that measure IgA antibodies might not detect it. Specific tests for alpha-gal antibodies or skin testing may be required for diagnosis. 8. Atypical presentation. In some cases, AGS may present with atypical symptoms or involve cross-reactions to other substances, making diagnosis more challenging. Due to these factors, individuals with AGS may go undiagnosed or be misdiagnosed for an extended period, leading to continued exposure to triggers and allergic reactions. What tests can help diagnose alpha-gal syndrome? Diagnosing alpha-gal syndrome, AGS, involves a combination of medical history assessment, physical examination, and specific laboratory tests. Since AGS is a unique type of allergy, traditional allergy tests that measure IgA antibodies may not be effective. Instead, specialized tests are used to identify the presence of alpha-gal antibodies or confirm an allergic reaction to alpha-gal. Some of the key tests that can help diagnose alpha-gal syndrome include 1. Alpha-gal antibody test. This blood test detects the presence of IgA antibodies specific to alpha-gal. It is the primary diagnostic test for AGS and helps confirm the allergic response to the alpha-gal carbohydrate. 2. Skin prick test. In some cases, skin prick testing with a solution containing alpha-gal extract may be performed. A small amount of the solution is applied to the skin, and the area is pricked or scratched to allow the solution to enter the skin. If the person is allergic to alpha-gal, a raised, itchy bump, wheal, may develop at the site of the test. 3. Basophil activation test, BAT. The BAT is a laboratory test that measures the activation of specific immune cells called basophils in response to exposure to alpha-gal. It is considered a research tool and is not widely available for clinical diagnosis. It's essential to note that alpha-gal testing is generally not included in standard allergy testing panels. Therefore, if AGS is suspected, it is crucial to inform your healthcare provider so that they can specifically request the appropriate tests. Medical history. The diagnostic process for AGS may also involve a detailed medical history and evaluation of allergic reactions to red meat or meat-derived products. Keeping a food diary that documents the timing and nature of allergic reactions can be helpful for the diagnosis. Is there a cure for alpha-gal syndrome? As of now, there is no cure for alpha-gal syndrome, AGS. AGS is considered a chronic condition, and the primary approach to managing it involves avoiding exposure to alpha-gal to prevent allergic reactions. If someone is diagnosed with AGS, the following steps can help manage the condition and reduce the risk of allergic reactions. 1. Avoiding red meat and meat-derived products. The cornerstone of AGS management is to avoid consuming red meat, such as beef, pork, lamb, and other mammalian meats, as well as products containing alpha-gal, such as certain medications or gelatin-based products. 2. Reading product labels. It's essential to carefully read food labels and ingredient lists to identify potential sources of alpha-gal. Some processed or prepackaged foods may contain hidden sources of alpha-gal. 3. Communication with healthcare providers. Inform your healthcare providers about your AGS diagnosis, including your primary care physician, allergist, and any specialists you may be seeing. They can help ensure that medications and treatments prescribed to you do not contain alpha-gal or trigger allergic reactions. 4. Carrying an epinephrine auto-injector, EpiPen, for individuals with a history of severe allergic reactions or anaphylaxis. Carrying an epinephrine auto-injector is crucial in case of accidental exposure to alpha-gal. 5. Identifying cross-reactivities. Some individuals with AGS may experience cross-reactivity to other substances, such as certain medications or insect stings. Identifying and avoiding these triggers is essential. It's important to note that research into alpha-gal syndrome is ongoing, and new treatments or therapies may become available in the future. However, as of now, the focus remains on allergen avoidance and symptom management. Who might be on my treatment team for alpha-gal syndrome? The treatment team for alpha-gal syndrome, AGS, typically consists of various healthcare professionals who work together to manage the condition effectively. The team may include 1. Allergist/immunologist. An allergist or immunologist is a specialist in diagnosing and treating allergies and immune system disorders. They play a central role in the management of AGS, conducting diagnostic tests, confirming the diagnosis, and providing guidance on allergen avoidance and treatment options. 2. Primary care physician. PCP, your primary care physician is often the first point of contact for healthcare and can help coordinate your overall care. They may refer you to specialists, such as an allergist or other healthcare professionals, as needed. 3. Dietitian/nutritionist. A dietitian or nutritionist can provide valuable advice on maintaining a balanced diet while avoiding red meat and alpha-gal containing products. They can help ensure you get all the necessary nutrients from alternative food sources. 4. Pharmacist. A pharmacist can review your medications to check for any potential sources of alpha-gal and recommend suitable alternatives if needed. 5. Emergency room (ER) team. In the event of a severe allergic reaction or anaphylaxis, the ER team plays a critical role in providing immediate medical care. They can administer epinephrine and other emergency treatments. 6. Dermatologist. If you experience skin-related symptoms like hives or rash due to AGS, a dermatologist can provide specialized care for managing these conditions. 7. Other specialists, depending on individual needs and any other medical conditions you may have. Other specialists, such as gastroenterologists, pulmonologists, or cardiologists, may be involved in your care. 8. Support network. Family, friends, and support groups for individuals with AGS can be valuable in providing emotional support and practical advice for coping with the condition. Coordination and communication among all members of the treatment team are essential to ensure comprehensive and effective care for AGS. As the patient, you are also a crucial member of the team, actively participating in your care. Adhering to treatment plans, and communicating your needs and concerns to your healthcare providers. How is alpha-gal syndrome treated? The primary approach to treating alpha-gal syndrome, AGS, involves avoiding exposure to alpha-gal to prevent allergic reactions. Since AGS is triggered by the consumption of red meat and meat-derived products containing alpha-gal, the following strategies are commonly used for managing the condition. 1. Avoiding red meat. The cornerstone of AGS management is to completely avoid consuming red meat, such as beef, pork, lamb, and other mammalian meats. 2. Reading product labels. It's essential to carefully read food labels and ingredient lists to identify potential sources of alpha-gal. Some processed or prepackaged foods may contain hidden sources of alpha-gal, so checking labels is crucial. 3. Medication review. Inform your healthcare providers about your AGS diagnosis, including your primary care physician, allergist, and any specialists you may be seeing. They can help ensure that medications and treatments prescribed to you do not contain alpha-gal or trigger allergic reactions. 4. Alternative protein sources. Since red meat is a significant source of protein, individuals with AGS need to find alternative protein sources. Safe protein alternatives can include poultry, fish, seafood, eggs, dairy products, legumes, nuts, and plant-based proteins. 5. Carrying an epinephrine auto-injector, EpiPen, for individuals with a history of severe allergic reactions or anaphylaxis. Carrying an epinephrine auto-injector is crucial in case of accidental exposure to alpha-gal. 6. Identifying cross-reactivities. Some individuals with AGS may experience cross-reactivity to other substances, such as certain medications or insect stings. Identifying and avoiding these triggers is essential. 7. Allergy action plan. Work with your allergist to create an allergy action plan, which includes steps to follow if you accidentally consume alpha-gal or experience an allergic reaction. 8. Physicians may recommend rescue medications, such as antihistamines or an epinephrine, adrenaline, injector. Other treatments depend on your symptoms. Oral cromolyn solution can help with GI symptoms. It's important to note that there is currently no cure for AGS. The focus of treatment is on allergen avoidance and symptom management. Who is at risk for alpha-gal? People who are at risk for alpha-gal syndrome, AGS, are typically those who have been exposed to ticks that carry the alpha-gal carbohydrate. The primary tick species associated with AGS is the lonestartick, which is prevalent in certain regions of the United States, particularly the southeastern states. The following factors may increase the risk of developing alpha-gal syndrome. 1. Geographic location, living or spending time in areas where lone star ticks are prevalent, such as the southeastern United States, increases the risk of tick bites and potential exposure to alpha-gal. 2. Outdoor activities, engaging in outdoor activities, such as hiking, camping, gardening, or hunting, in tick-infested areas can increase the likelihood of tick bites. 3. Tick bites, having a history of tick bites, especially from lone star ticks or other tick species that may carry alpha-gal, increases the risk of developing AGS. 4. Previous sensitization, some individuals may already be sensitized to alpha-gal through exposure to alpha-gal containing substances in the environment or through other means. This prior sensitization may increase the risk of developing AGS upon subsequent tick bites. It's important to note that not everyone who is bitten by ticks carrying the alpha-gal molecule will develop AGS. The development of AGS seems to depend on individual factors, such as genetics and previous allergic sensitivities. Additionally, AGS is more commonly reported in adults than in children. How can I reduce my risk of developing alpha-gal syndrome? Reducing the risk of developing alpha-gal syndrome, AGS, primarily involves taking precautions to minimize tick bites and potential exposure to the alpha-gal carbohydrate. Here are some steps you can take to lower your risk of AGS. 1. Use tick repellent, when spending time outdoors in areas known to have ticks. Use insect repellents containing DEET, picaridin, or permethrin on exposed skin and clothing. Follow the product's instructions for application. 2. Wear protective clothing. Wear long-sleeved shirts, long pants, and closed-toe shoes when hiking, camping, or engaging in outdoor activities in tick-prone areas. Tuck pants into socks or boots to create a barrier against ticks. 3. Avoid tick-infested areas, stay away from tall grasses, wooded areas, and underbrush where ticks are commonly found. Stick to marked trails when hiking. 4. Perform tick checks. After spending time outdoors, thoroughly check your body for ticks. Pay special attention to areas like the armpits, groin, scalp, behind the ears, and the back of the knees. 5. Promptly remove attached ticks, if you find a tick attached to your skin. Use fine-tip tweezers to grasp the tick as close to the skin surface as possible and gently pull upward with steady pressure. Clean the bite area and your hands with rubbing alcohol, an iodine scrub, or soap and water after tick removal. 6. Tick control in your yard. Reduce tick exposure in your yard by keeping grass mowed short, removing leaf litter and brush, and creating a barrier between wooded areas and your lawn. 7. Check pets. Ticks can attach to pets and potentially transfer to humans. Regularly check your pets for ticks, and consult with your veterinarian about tick prevention measures for your pets. 8. Be cautious about red meat consumption, if you live in or visit regions with known lone star tick populations. Be aware of AGS symptoms and seek medical attention if you experience any allergic reactions after consuming red meat or meat-derived products. While these measures can help reduce the risk of tick bites and potential alpha-gal exposure, it's important to note that not all tick bites result in AGS. The development of AGS seems to depend on individual factors, and not everyone exposed to ticks carrying alpha-gal will develop the condition. What foods and products should I avoid if I have alpha-gal syndrome? If you have alpha-gal syndrome, AGS, it is essential to avoid consuming foods and products that contain alpha-gal to prevent allergic reactions. Alpha-gal is a carbohydrate molecule found in the meat of mammals, particularly red meat. Here are some foods and products you should avoid if you have AGS. 1. Red meat. Avoid eating beef, pork, lamb, veal, and other mammalian meats. 2. Processed meats. Stay away from processed meats like bacon, sausages, hot dogs, ham, and deli meats, as they often contain alpha-gal. 3. Meat-based broths and stocks. Avoid consuming soups, stews, or sauces made with meat-based broths, as they may contain alpha-gal. 4. Gelatin. Gelatin is derived from animal collagen and may contain alpha-gal. Avoid foods containing gelatin, such as gelatin desserts, gummy candies, marshmallows, and some pharmaceutical capsules. 5. Certain medications. Some medications, particularly certain oral medications, may contain alpha-gal as an excipient or an active ingredient. Inform your healthcare providers about your AGS diagnosis to avoid medications with alpha-gal. 6. Cosmetics and personal care products. Check the ingredient lists of cosmetics, lotions, and personal care products, as some may contain alpha-gal. 7. Vaccines and medical products. Certain vaccines, intravenous medications, and other medical products may contain alpha-gal. Discuss your AGS diagnosis with your healthcare provider before receiving any medical treatments. 8. Some dairy products. While dairy products themselves do not contain alpha-gal, some processed dairy products, such as certain ice creams or desserts with meat-based additives or gelatin, may be problematic. Remember that alpha-gal is not present in fish, poultry, chicken, turkey, duck, or plant-based foods. These can be safe protein sources for individuals with AGS. Additionally, always read food labels carefully to check for any hidden sources of alpha-gal or cross-contamination. What's the outlook for alpha-gal syndrome? Alpha-gal syndrome, AGS, is generally considered a chronic condition. The outlook for individuals with AGS can vary depending on the severity of their allergic reactions, their ability to avoid exposure to alpha-gal, and individual factors. Here are some key points to consider regarding the outlook for AGS. 1. Management through avoidance. The primary approach to managing AGS involves avoiding exposure to alpha-gal. By diligently avoiding red meat and meat-derived products, individuals with AGS can significantly reduce the risk of allergic reactions. 2. Varying severity. The severity of AGS symptoms can vary from person to person. Some individuals may experience mild reactions, while others may be more sensitive and have more severe allergic responses. 3. Risk of allergic reactions. Despite best efforts to avoid alpha-gal, accidental exposures can still occur. Vigilance and preparedness, such as carrying an epinephrine auto-injector, EpiPen, for emergencies, are essential. 4. Ongoing research. As research into AGS continues, there is potential for new treatment options or therapies to be developed in the future. However, at present, allergen avoidance remains the primary focus of management. 5. Individual variation. Some individuals with AGS may experience a decrease in sensitivity over time, while others may not see any change. The response to AGS can be highly individualized. 6. Quality of life. With proper management and avoidance, many individuals with AGS can lead fulfilling lives and maintain good quality of life. Overall, working closely with healthcare professionals, following a personalized management plan, and being proactive in avoiding alpha-gal can contribute to better outcomes and improved quality of life for individuals with AGS.